My name is Alejandra Plaza.
I'm Alejandra Diaz,
I'm Dana Cojocaru.
And my name is Maria Jose Gil.
and we are some students from Gimnasio La Colina, and this is our Global Studies project.
In this opportunity, we are going to talk about health and diseases issues, focusing on sexual transmitted diseases.
That is why we decided to make some interviews to students from 7th to 10th grade.
Our goal is to make awareness of the most common STDs and how to prevent them.
In what ways can we protect ourselves in a sexual encounter?
Contraceptives.
Condoms, the pills, the feminine protection, and there are different ways. Like, I don't know all of them, but I know like some of them are physical and some of them can be like injected, I guess it was, for the hormones.
Condoms, pills, and
with condom and contraceptive pills.
with condoms or contraceptive pills.
More than 1 million sexually transmitted infections, STEs, are acquired every day worldwide.
Which contraceptives can protect you from getting pregnant?
I don't know.
So I already said condoms, the peel. We can, well, men can have like their surgery in their testicles. Women can, I don't know, take off their fallopian tubes. We can use, well, we can take it off at the moment of ejaculation. That's it.
I don't know.
With the T, I think it's called, the battery or contraceptive pills.
That more of 2,090 women have HPV.
Which contraceptive can protect you from STDs?
Only the ones that avoid your skin to touch the other one's skin, to say it like that, will be like condoms. Because pills, if you take pills, that will only avoid you for not having children, but that will not avoid the fact that your intimate part is touching the other one's intimate part, which is the main cause of STDs.
I don't know.
Condoms, the feminine contraceptive, and I guess both of them. I don't know anything else.
I really don't know. I think pills.
And use, the only one I know is condoms.
More than 500 million people are estimated to have genital infection with herpes simplex virus.
Which sexually transmitted diseases do you know?
AIDS, gonorrhea, and herpes.
Gonorrhea, syphilis, herpes.
AIDS. I don't know. Anything else?
I think AIDS, I think is one.
AIDS and HIV.
Gonorrhea, AIDS,
From 1 to 5, with 5 being very well informed and 1 being not informed at all, how would you rate your knowledge from the following STDs?
Gonorrhea,
1,
HIV,
1,
HPV,
1,
herpes,
2,
and chlamydia.
1,
Gonorrhea.
3. HIV,
2.
HPV,
1.
herpes,
4.
chlamydia.
2.
Gonorrhea. 1. HIV. 2. HPV. 1. Herpes. 1. Chlamydia. 1.
Gonorrhea,
3.
HIV, HPV,
2.
herpes,
3.
chlamydia.
Like 2.
Gonorrhea,
1,
HIV,
2,
HPV,
1,
herpes,
2,
and chlamydia?
1.
Each year, there's an estimated 357 new infections with 1 to 4 STDs, like chlamydia, gonorrhea, and syphilis.
Did you know that most of STIs have no symptoms or mild symptoms that may not be recognized as an STI? What would you like to know about this topic?
I would like to know if there's something we can do to, at the moment of getting AIDS, if we can like make something to become normal again.
Probably like how all the contraceptives work on the body, how they can be used, how can you apply them, how can you look for them, and the diseases.
How to protect ourselves, and like the consequences of the problem.
What they can cause in the pregnancy, their symptoms, and that's it.
I want to know everything. Like, what are the symptoms of the sexual transmission diseases, and like, which are they? Yeah.
Effects that diseases can have in the human body.
Did you know that it is estimated that undiagnosed STEs cause 24,000 women to become infertile each year? I didn't know that young people ages 15 to 24 accounted for 65% of chlamydia diagnosis and 50% of gonorrhea diagnosis in 2018 worldwide.
Which are the most common contraceptive and which of them protect us from STDs?
One of the most common contraceptives is the pill. This would help you from getting pregnant in 95% of cases and almost 99% if you take it every day as prescribed. Even though the pill would not protect you from any STD.
The male condom is easy to use, affordable, and offers the best protection against diseases such as gonorrhea, chlamydia, HIV. This is because it avoids contact with the other genital parts.
Now we have the female condom, which offers a 95% effective protection for pregnancy and some protection from STDs.
Finally, the cervical cup, thin cup, offers only partial protection against STIs. It has no HIV protection. And now, what are the most common STDs?
First, gonorrhea.
Gonorrhea is a sexually transmitted disease. It tends to infect the urethra, eyes, throat, vagina, anus, and the female reproductive tract. They occur within 2 to 14 days after exposure. Not everyone may have the same symptoms. In men, they could be burning or painful sensation during urination, a pus-like discharge from the penis. It could be white, yellow, or green, swelling or pain in the testicles. In women, they could be discharge from the vagina, being watery, creamy, or slightly green, pain or burning sensation during urination, heavier periods, fever, and some more. Gonorrhea can be cured with the right treatment. The Center for Disease Control and Prevention recommends to take all the medication prescribed to cure this infection. This pill should not be shared with anyone. The treatment will stop the infection, but it will not repair any permanent damage done by the disease. Finally, untreated gonorrhea can cause serious health problems in both sexes.
Chlamydia is a very common bacterial infection that can be transmitted from a sexual contact with another person. It affects both men and women. Women can get chlamydia in the cervix, rectum, or throat. Men can get it in the urethra, rectum, or throat. Chlamydia doesn't usually cause any symptoms, so you may not realize that you have this disease. However, if you do have symptoms, they may appear several weeks after having sex. In women, some of them are abnormal vaginal discharge causing a strong smell, a burning sensation when urinating, pain during sex, abdominal pain, nausea, or fever. In men, some of them are discharge from your penis, burning sensation when urinating, pain and swelling in one or both testes, rectal pain, or bleeding. Antibiotics will cure the infection. However, you may need to take several pills every day for a week. Anyhow, antibiotics cannot repair any permanent damage that the disease has caused. Also, you should get tested again about 3 months after treatment because it's common to get a repeat infection.
Human papillomavirus is the most common sexually transmitted disease. There are many different types of HPV. Some types can cause health problems, including warts and cancer. You can get it by having vaginal, anal, or oral sex. It is most commonly spread during vaginal or anal sex. Most of the people with HPV doesn't have symptoms, but the symptoms include warts in the genitals or all over the skin. Condoms can help reduce the risk of genital HPV, but it doesn't provide 100% of protection against the disease. It depends on the stage. There isn't cure for the virus, but the warts can go away on their own with help of the treatment. For both gender, it is recommended to apply a vaccine that avoids HPV strains.
In terms of cultural perspectives of this issue, Colombia is not well prepared to address students and ensure they are well informed. There is little sexual education in school, and therefore rates of STDs and unwanted pregnancies are higher. Meanwhile, countries like France and Estonia have sexual education included in their school programs, and those countries have reduced the rate of young people getting STDs and unwanted pregnancies.
First, the Gimnasio La Colina's community isn't well informed about the sexual transmitted diseases.
Second, the community is not aware of the different contraceptives that exist.
And they do not understand the difference between the ones that are used to avoid getting pregnant or that avoid getting an STD.
Finally, we found that women are less informed than men. However, men are not completely informed.